Well, hello everybody. Welcome to Fertility Fact or Fiction. We are live on TikTok. Hi, Candace. And I think we are now live on Instagram, YouTube, Facebook, and X. T, can you hear me?
I can hear you loud and clear.
Oh, excellent. Okay, for all those of you who are fans of the show, T is in China. Where in China are you? Beijing?
Shanghai today.
Shanghai. Wow. All right. So T is in Shanghai. It is bright and early in the morning, and he is running on little sleep, but he is dedicated to the show. So here he is. It's pretty cool. But I don't know what you were thinking, but whatever. We're happy to have you here.
I can't help myself. I have to maintain my medical education, otherwise I'll lose my title as a doctor.
Okay, just so you know, as far as what I can see, I can only see me, and I'll probably see the question, but I can't see the private chat messages because I've got something holding up the TikTok.
Okay, no problem. I'll read them all out to you if there's anything. Not to worry.
Oh, I'll listen to that. Paige says my VRC baby is 11 days old today. Yay! That's so cute. Hello to Joe. And we've got questions coming in already. So there is no really great information to review today. I thought we were going to have a guest on, but it didn't pan out. So she's coming on in the new year. She's got a huge following, so we're very excited about that. And I'm going to be doing a recorded session with her coming up shortly. So I'm excited about that as well. And that's the Fertility dietitian. And she's great. I like her a lot. So we've had some robust debates, which have been interesting. And yeah, otherwise, we're going to take questions today because we haven't gotten to everybody's questions lately with all our guests. And T and I have been working hard on growing the show. Thank you to all those of you who have been watching our Instagram posts and following and liking. That's been helping us grow quite a bit. So that's great. So do you want
Don't
to
forget
read
to
out
like
the
us,
questions
guys.
like normal?
Absolutely. Always send your content questions. We love answering your own questions. We look for other ideas, but if you have your own questions that you need answered and you think will be benefit to the community, don't be shy.
Yeah, absolutely.
All right, first question, Dr. Victory. Hi, Dr. VNT. What are your thoughts on add back progesterone to help mitigate symptoms of Lupron/letrozole? The Lupron symptoms are so bad.
Yeah. So you can still get some stimulation of the endo, although it shouldn't be too bad. So some people do add back with progesterone. It has been shown to mitigate the symptoms. There's no data or studies on how well that will work. So I can't answer that part for you. I honestly don't know. Yeah. But
Dr. Victory, this is for you. Could you talk a little bit about the cohort study that was done on no difference in LBR endo?
The cohort study that was done on no difference LVR?
LBR endo.
Oh, live birth rate endo? Yeah, that study was done terribly. I've looked at that. So every other study has shown a very significant difference. That study is the only one that didn't, and it was not controlled properly. So that is not a well done study at all. That study is actually kind of a joke. So I'd be happy to shred it. But I've looked at that. It was a useless study.
From TikTok, when should we do the pregnancy test for 100% results?
2 weeks after your transfer.
Another question. Should I do a natural cycle or Lupron cycle?
Um, that's too vague a question. I need to know more details about you. Do you have endo? Do you not have endo? What's your past history? All of that stuff.
Next question. Hi, Dr. VNT. I just got my blood results, which came back as a weak positive for lupus anticoagulants.
Sure.
I've had 3 miscarriages. Is aspirin enough, or what will I need to do?
Well, we normally would confirm, but assuming that you confirm and that it shows that you have either endo or adeno, we would advocate for using a aspirin and sorry, not endo or adeno, lupus or thrombophilia. We would advocate for using aspirin plus a heparin type product like Lovenox or Inahep or something like that. So if we suspect you have true lupus, we use both.
What do you think about using androgel testosterone as a primer for egg retrieval?
We do it routinely for patients with diminished ovarian reserve. It works really well.
What are your recommendations around exercise in the first few weeks after a frozen embryo transfer?
Light exercise is fine. We don't recommend heavy exercise. Straining, stuff like that is not optimal. Joe
Um,
Rodriguez says, my wife and I see you in February. Very nervous. Don't be nervous. We're here to help.
yeah, it's a good thing you actually read that question because if I read it, I thought you might be confused that you think I'm actually coming to see you in February. So,
No,
so
you and
this way
your
you made
wife,
it easy for me.
you guys, you and Merv do not need fertility therapy.
You never know, man. We're getting old these days.
Yeah, I think you have enough kids, buddy. You guys are good.
Dear Dr. VNT, 38 years old with adenomyosis, transferred a single 5AB euploid embryo, only embryo from previous cycle. Beta was not doubling as they should, and instead was increasing very slowly. At around 6 weeks and after an ultrasound did not find a yolk sac, RE advised to stop all meds. RE said the cause could be either adenomyosis, difficulty in embryo irrigation, or immune system. Rejecting the embryo. What would you recommend advice for moving forward? Any different strategies? Thank you so much.
Yeah, I mean, we would look at everything, right? So we would do a detailed analysis of your microbiome, of your immune system. They should have already known if you had adeno. If you do or endo, we would use our endo adeno protocol. We would really dig into it to see what's wrong. Make sure we fix everything that we find. So we don't generally just kind of try stuff. We actually assess, analyze, figure out what's wrong, and then we fix it.
What is doxycycline beneficial in IVF?
It's only beneficial if you have an infection, especially something like ureaplasma, mycoplasma, something like that. Then we use it.
Regarding the previous endo study on live birth rates, cited that when I asked for Lupron, the doc cited that study when I asked for my Lupron letrozole. Does Lupron cause acne and weight gain?
Not usually. Weight gain, maybe, not acne. Not typically.
Question that appears to be non-related to fertility, but maybe I'm missing it here. Is there a cure for pigment skin?
It depends on where the pigment is and what's going on. There can be. There are treatments you can use to prevent depigmenting of skin, like vitiligo. If you're getting pigmentations, you need to know what it is first before before you go into it. So,
Hey, Dr. V, that is you, sir. Can you please go through the natural cycle monitoring process and what it entails? HSG?
we don't use HSG unless you fail an SIS. So the normal natural cycle monitoring process is like an ultrasound and blood work day 3, maybe 8, 10, 12, 14, and then on 23, we look at your progesterone level. On the other days, we're looking at E2, LH, and ultrasounds to look at lining thickness, shape of your uterus. In between there somewhere, we do an ultrasound for saline infusion sonohystogram, and we use that SIS to assess the cavity shape, the size of the uterus, whether your tubes are open, what do your ovaries look like, all of that stuff. So that's kind of our approach to natural cycle monitoring.
What progesterone level is too high after a modified natural FET? Would it prevent implantation?
In Canadian units, if you're over 100 and you don't have endo, you're getting up there.
Diagnosed with unexplained infertility, 39 years old with thyroid disorder. What can be done?
Well, unexplained infertility generally just means they didn't study enough or test enough to know what's wrong. So we would look at things like your immune system, your microbiome, check for endo, check for adeno, look at sperm DNA fragmentation, look at sperm oxidative stress, hyaluronic acid binding. Like there's a bunch of extra tests that can be done before you actually declare someone has unexplained. Obviously, your thyroid should be corrected, but we kind of take a very holistic approach. We examine everything and then we figure out what's wrong. I, you know, have recently been posting some of the feedback people give us, and like it's really clear. We dive into every detail, and because of that, we do better. I just posted today, like we don't just do it better, we do it right, and I don't mean that facetiously. Like there's a right way and a wrong way to do things, and I feel strongly about what we do because the results speak for themselves. We just do a good job. Yeah.
I sent you an email if you're able to look at it and
You did?
winging it on the show here. But I thought if you want to talk to it, it might be a good little moment there.
You sent me an email?
Yeah. Not too long ago, I sent you an email just to interrupt the questions a little bit with an interesting fact that they're saying is a new study, and I thought your take on it would be quite interesting to hear
Okay, hang on
live.
a second.
While
Article
while that
talk on the
goes, I'll give
show.
you an easy one. What do you
Infertility
think
without
about?
treatment. That one?
Yeah, that's the one.
Linked to autoimmune rheumatic disease after childbirth. Yeah, I actually saw that recently. Yeah, so there's all sorts of things that may be related to infertility that we are learning about that are important things for us to take a look at. So, in this particular study, they did show that there is a higher incidence rate of rheumatic disease, autoimmune rheumatic diseases after childbirth, even if you haven't had treatment for the fertility. So yeah, there's no question. There's other things too: preeclampsia, heart disease, all sorts of cancer are associated with the infertility diagnosis, but not the treatment. So don't panic, folks. So yeah, there's a lot of that out there for sure. Yeah,
Little something for you to share with the listeners in real time.
yeah, for sure.
Question: what do you think about using androgen testosterone as a primer for egg retrieval?
You asked that one.
Okay. What do you think about using a max trigger of 10,000 UIs prior to a retrieval?
So HCG at 10,000 international units is great, but you got to be careful about developing OHSS, number one. Number two, you have to be careful that you are not only using HCG, because HCG alone is not as good as a double trigger. We're going to review that on an upcoming show because there was a recent meta-analysis on that. And yeah, so it just depends on how they're triggering you and how many eggs you have. If you have a lot of eggs and you have a high estrogen level and you take 10K of HCG, you're going to develop ovarian hyperstimulation syndrome. So you have to be cautious, but it's totally usable. We do it all the time.
Is there harm in hormone suppression if endo is suspected, not confirmed?
No, there's no harm, but it won't feel great. You'll be miserable, right? So that's not a great outcome for you, but there's no harm from it, not at all.
Trying to pull another one from Instagram here for you. Hey, Dr. VNT, just wondering what the triggers are in a Lupron flare. Was only prescribed HCG.
So typically, if you're doing a Lupron flare, you can still do a Lupron trigger. It'll probably be a lot less effective, but you can still do it, and we do. And you need a relatively high dose of HCG. So those would be your methods for doing it.
Which supplements do you continue throughout pregnancy and which do you stop after pregnancy is confirmed?
We tend not to stop any of our supplements. If you don't have endo or PCOS, all our patients are on a prenatal coenzyme Q10, melatonin, vitamin D. Some of them are on iron, so we just keep everybody on that.
39 years old, AMH 1.9 nanograms per mil, post of stage 4 endometriosis. Doctor recommended mini stim and only one follicle responded out of 13. Would it be worth trying a higher dose? Other ideas for what to try next?
Yeah, so I would probably want to prime you. Make sure you didn't take any birth control or Lupron ahead of time. Testosterone, human growth hormone priming, maybe DHEA. And then we would do a medium dose stim, not a mini stim. And then we would do double trigger and do the retrieval. And you might need flushing because endo eggs tend to be sticky. They don't come out without a battle.
There was another article on because I want to take your natural reaction on this.
You're driving me crazy. I can't, the worst part of this is I can't even see my screen properly. Let me see if I shrink it and move it around, if I can set that.
Should I read it to you? Would you rather I read it to you? And
No,
then you can
no, hang
just
on.
read.
I got it. I got it. Hang on.
All right, hold on. Now you
Did you
got it. You
send it
didn't
to
get it
me?
before. I sent it to you. Yeah, yeah. You should have it. Maybe it didn't show up yet.
No, not yet.
I feel like I'm about to fall sick before my ER. Headache, sore throat. Does this affect outcomes?
Yeah, I mean, if you're sick, it can impact everything. We try to avoid it, but I mean, it can definitely happen. You can definitely end up with problems. Unfortunately, if you're midway through it or whatever, there's nothing you can do, right? So, yeah.
Are there any fertility clinics that you work with in Kitchener Waterloo area or close to it?
We have a clinic opening in Woodstock, so no, we just use ours. Yeah.
There you go. Woodstock Clinic. Don't use anybody else's.
Have you? Are you seeing that post from people on the roof? Have you people seen a baby goat in your area? I don't know where people get this from. It's hilarious. All right, go ahead.
I'm working on getting the real questions here. This goat on the roof thing is too much. Can you talk
Uh,
about here you go? Can you talk about the pros and cons about Zymote? Would it help if morphology is low, but count and motility are really good?
it might because it'll screen out the abnormal sperm, and it does drastically reduce DNA fragmentation. There's no really great evidence for Zyma. The best study so far showed that they had an increase in fertilization, but no other outcome was different. So it's still not like a proven thing. It looks like it's maybe slightly helpful, but it's not like drastically better than anything else.
From Instagram, when to restart aspirin after being diagnosed with SCH?
Yeah, so I wouldn't start it till your SCH is gone. And ever since our show on ALA, I've actually been using ALA in people a lot. That stuff is awesome. I had a
Oh,
lady.
you're noticing a difference right away.
Oh yeah, I had a lady that her amnion had actually detached a little bit, and they could see it, and they saw this big sliver of blood there. I gave her ALA, and the ultrasound today said it's refused. So like, it's
Wow.
really good. It's really, really good. Yeah.
I feel. Oh, sorry. Hi, Dr. V. I had two failed FETs with euploids. Did all the testing. Only thing came back abnormal was fertility microbiome. I am currently on antibiotics. Do you see success after antibiotics? Any other tips?
So antibiotics alone is not enough. You typically need boric acid and then a super high dose probiotic protocol with the antibiotics. Just doing the one alone doesn't really do very much. So we typically tend to have like a whole dedicated protocol for this. Do we see success? Huge success. So in our own research, when we had patients that had failed, and then we did fertility testing, and then we did the embryo transfer. 91% of our patients got pregnant. So it's a big deal for sure.
Do you
I'd
recommend
love to say it's
PRP?
all us, but the reality is we are better with fertility. We do a really good job with them. So I love using them.
Do you recommend PRP before a transfer, even if I've never had lining issues? What are the benefits?
Um, we don't recommend it depending on how many embryos you have. The major benefit of PRP prior to a transfer is either for endometrial thickness or for unexplained failures. So if you have unexplained failures and you use PRP before your embryo transfer, it's a 50% increase in live birth according to the studies. So we use it for that purpose, but we don't use it like if you've got 10 embryos and you're just trying for the first time, we don't use it for that.
Here's a question that I think is a little bit offensive and disrespectful, but I'm gonna ask it anyway. So just
Okay,
prepare yourself, okay?
I'm prepared.
So Dr. Victory, of course. What is your favorite gift you ever received from a patient? You know,
That's
and
why
obviously,
you
yeah,
that's why it's disrespectful because they didn't ask you.
yeah. I think like,
I was like, where is he
what,
going with this? That's
what
hilarious.
about me?
Wow. That one's easy. A very dear friend of mine who I helped bought me a watch. The watch is like a very, very nice watch. That was definitely a very, very generous, very kind gift. Had they not been friends, I never would have accepted, but they were friends ahead of time. So, yeah, that was a very lovely gift.
There you go. Favorite gift.
And I have a whole
I also like gifts too, but I guess that's not really that important in today's question.
yeah, yeah, definitely
Um,
one of my favorite gifts ever. Very, very meaningful, very thoughtful, very cool.
what does it mean if your DHEA hormone is high?
If you're which hormone?
DHEA hormone is high.
Oh, well, it depends. I mean, if you're taking DHEA, it means you're taking DHEA. If you're naturally high in your DHEA, it can be a hormonal problem, like congenital adrenal hyperplasia or other hormonal issue like PCOS, which is driving up your androgen levels. So that's something that needs to be investigated. This is all assuming that the person asking is female.
The name is Bun. Can't tell
Yeah, could be anything.
what that is.
These days,
Yeah.
names don't make a difference, man.
Yeah. It's Bun and a picture of a rabbit. So it could even be a rabbit that's asking the question, to be honest.
I
You
think you
never
need
know
more
these
sleep,
days.
buddy.
Dr. V and
Yeah,
Dr. T.
yeah.
All right, this is for us, Roy.
Okay.
I have low AMH, DOR, FSH around 10. My period was missed, not pregs. Gearing up for IVF. Doctor wants me to do BC for 10 days to induce the period. Thoughts doing a final IVF at 38?
There's no benefit to inducing a period prior to IVF because your period's irrelevant to your success. So you don't need a period in order to start IVF unless you're trying to do a fresh transfer. And we don't recommend doing that almost anywhere. So yeah, you can just fire ahead. Taking birth control pill will suppress you. So if you already have weak ovaries, that's a really, really bad idea, actually.
Can you discuss short-term decapity hormone suppression versus Lupron? Suspected endo not confirmed on large masses or surgery.
I missed the short-term what suppression?
Decapity?
Decapeptyl?
Oh, they're missing the L, but yeah, that looks like what could it be? Decapeptyl. Yep.
It's the same thing. Decapeptyl and Lupron are going to give you the exact same outcome.
Any suggestions for endo protocol instead of Lupron?
Well, we don't use Lupron alone. So it's Lupron plus letrozole, 5 different supplements that are designed to reduce the inflammation. We do an immune protocol with metformin, intralipids, steroids, Plaquenil, and we use double progesterone high dose. So my belief is that endo protocols need to be custom tailored to the patient and require a lot more involvement than just, garden variety stuff.
There's a
Like
brilliant
Lupron alone is,
question on TikTok I have to jump towards.
yeah.
Aspiring Dr. T, how's your surgery shadowing going? Well, since you asked, of course, this is from Candace, of course. Well, Candace, I got in the room a couple of times, and we did the egg transfer. Dr. Victor was doing most of the work. I'm not gonna lie. I was just there making sure he was doing it right. I was watching over him, ensuring he's make sure he's flushing properly and whatnot. So
Yeah,
overall, pretty good.
that's
Overall,
right. You
pretty
were
good, I
there
would
for
say.
flushing. We videoed
I
flushing.
I was absolutely there for
We
flushing.
need a video on flushing. No one
Yeah,
has
yeah.
that. We got to show a flushing video. We
You
got
gotta
to do.
show them how to flush.
You gotta release that one like tomorrow or something. Oh, I gotta voice it.
Well, it needs your voiceover. That's the problem with that.
Yeah. Okay. All right. Yeah, we got to do that as soon as possible. That's a good one.
Yeah,
Yeah.
that was beautiful, to be honest. Great,
Yeah.
great, great work.
Yeah.
Great work.
Yeah.
I learned a lot that day, to be honest.
That was pretty cool. Yeah, you did see a lot that day. So that was pretty.
I actually felt that if I actually were to do it, maybe I could do it. But I don't
Uh,
know who would allow me to do it on them,
it's
to be quite
it's
honest.
tougher than you think, but it's
Oh, my
it's
biggest fear is that you're completely blind. Like you just got to use the ultrasound to know where you're going. Like
you got to
it's
be
very
really
delicate
good with the
movement.
ultrasound. That's the key. Yeah.
Yeah, that's very delicate movement, and I'd have to be on no coffee before I go into it because I'm a good couple cups of coffee into it by that time, so my hands would be
Hey,
all,
you
you
start your
know.
day with 2 cups. We learned that last weekend, man.
Yeah, yeah, we don't need any more than that. We don't need any shakes going on. Um, Instagram. Hi, Dr. V. In your experience, do you find higher success after clearing inflammation identified by Fertility after a failed FETs with euploids?
Oh God, yeah, of course. Yeah, absolutely. Reducing inflammation makes a night and day difference.
Hi, Dr. V and T. Just wondering if there are any ways to prevent subchronic hematoma and bleeding.
Yeah, take ALA. It looks like it prevents it. So take ALA.
What do you recommend to help with sperm morphology?
Um, Fertility vitamins for men, frequent ejaculation every day or every other day, cold therapy for your testicles, avoid heat, cell phones, electromagnetic radiation, laptops, car seat heaters. Um, and then no smoking, no drinking, no drugs. All of those will help.
Can G cause side effects?
Yeah. You can get infections from HSGs. You can have pain from HSGs. Those are the main side effects. And then, of course, there's a fairly high rate of pregnancy after an HSG. So a lot of people will get pregnant. And do they
Do they
flush out your
flush out
tubes?
your fallopian? Sorry. Do they
Yeah.
flush out
Yeah,
your
they do.
fallopian tube after?
Yeah, they do. The process actually flushes out your tubes.
HSG shows tubes not visible, but there was a spill patency. Is that possible?
No. I mean, you should be able to see them if they saw it leaking. So unless the tube is so narrow, it's difficult to see the stream going through there, but I've never seen that before. It is hard to see sometimes, but typically we can see it if we're looking carefully. Yeah,
What do you think about using a max trigger of 10,000 UIs prior to retrieval?
we did that one.
Yeah, I think so. When should blood thinning daily vitamins be stopped when C-section has been scheduled? I take prenatal, methylfolate, aspirin 81, fish oil, and iron.
Aspirin, you can just stop the day before, but it's not going to help you because otherwise it would have to be stopped 21 days before. We don't do that. Vitamins, we wouldn't stop any of your vitamins. We keep on all of those because you want to stay on them during breastfeeding. So we just keep our patients on them.
Is there any harm in those vitamins being taken even post pregnancy and delivery, Dr. Victory?
No, that's why we keep them on.
Should people stay on them forever?
Yeah, I mean, the
Or is it
vitamins
strictly a pregnancy
on
thing?
are harmless, so there's no reason not to put people on them forever, but like everybody's different, right? So
Yeah. 31 years old, Hashimoto's excision surgery 5 months ago. Best IVF protocol? Lupron? Question mark.
depends on your ovarian reserve, but I mean, we use a balance of a recombinant and a urinary, which is Gonalef, Puregon, Recavel plus Menopur. Um, like any of the first three plus Menopur. And then we try not to go past 11 or 12 days. There's like a lot of people out there taking these. I've learned recently there are people doing like 15, 16-day long protocols. Yeah, that's crazy. Don't do that. It's terrible for your egg quality. One whole group of patients from one clinic in Toronto have a dedicated Facebook group to women that have done 16 to 24-day cycles. I mean, that's completely bonkers. Like, it makes absolutely zero sense, no sense whatsoever at all. So please don't do that. And then we would use medium dose. We never go high. Lots of people are getting high doses. That's proven detrimental. Yeah, so I mean, there's a lot of info out there on how to do a good endo protocol. Trigger, double trigger, make sure they're flushing at retrieval. All of that would be really important.
Does myoinositol beneficial for endometriosis if trying for pregnancy?
Not that I've ever seen.
Do people with endometriosis typically have a higher DHEA and testosterone level?
Sorry, ask that again.
Do people with endometriosis typically have a higher DHEA and testosterone level?
Not that I've ever seen. Maybe they do, but I've never seen any data on that whatsoever.
Could a cycle of IVF, egg retrieval only, suppress the immune system? I got a cold 2 days after my egg retrieval and it lasted almost 2 months. I also got a UTI during that time. Thank you.
Not typically, no. No, I mean, there's no relationship between a routine egg retrieval and suppression of your immune system unless you received steroids or something like that. But you shouldn't have if you're just doing egg retrieval. So that would be a very bizarre outcome, like very, very bizarre. I don't know why anybody would get that. Strange.
I had a hysteroscopy. My period became absent after 5M post op. I have been diagnosed with scar tissue in the uterus. What is the likelihood of getting pregnant after another hysteroscopy, or will I just continue to develop more and more scar tissue?
So the depending on your surgeon and the technique used, the cure from Asherman syndrome can be pretty good, and you can find that your response is quite good to treatment. You will frequently need a special type of hysteroscope, and they need to use scissors to cut the adhesions. Electrocautery can be potentially detrimental. So yeah, I mean, there's things you can do that'll give you a reasonable chance. we tend to pre-treat and post-treat with relatively high doses of estrogen. So things like that can make a big difference to improve your outcomes. So there are ways to fix it. Sometimes you need a balloon in there as well. It really depends on the severity of the scarring and who your surgeon is. You need a top-notch surgeon for that kind of situation.
I'm available if anybody's really looking.
No, he's not. But anyways, keep going.
What is the purpose of priming with esterase before starting a stim cycle?
Well, the idea behind it is that it lines up the follicles together, but there are now 2 randomized controlled trials showing absolutely no benefit, so no one should be doing that. And it's particularly dumb for people with endo, so I just don't do it.
When do you recommend Neupogen and
Oh, you broke up there. When do I recommend Neupogen and what? T?
HSG wash
Oh,
before an FET? And are Neupogen and an HSG wash?
I think they mean HCG wash. Neupogen and HCG wash, previous failures, unexplained failures. Neupogen wash if the lining's thin. That can be helpful too. But mainly it's for unexplained failures or previous failures.
Can you have endometriosis 28-day cycle? And do you recommend to start off with Clomid before the IUI?
Endometriosis has nothing to do with the length of your cycle. So yes, of course, women with normal length cycles can still have endo. Do I recommend Clomid before an IUI? It depends on what's wrong. Sometimes we recommend Clomid, sometimes we recommend letrozole, sometimes shots, sometimes nothing. I would need to know more about you and know what's wrong.
If after endosurgery and suppression FET fails, what are the tests that you would do?
Fertility, so microbiome testing, immune testing, stuff like that. We figure it all out. We would go over things, make sure we know what's wrong, figure out, the details of it all, sort out problems like whether or not you have endometriosis. We would figure out your immune system. We would figure out what your microbiome is like. Microbiome can take months to correct, and there are people that just don't get fixed. I have one lady, she's been trying for 6 months. I can't fix her lining. Like, it just won't correct. I've tried everything.
Thoughts on tube tying after being done with kids?
Removing your tubes reduces your risks of fallopian tube and ovarian cancer drastically. So that's a very reasonable choice. You can keep your tubes, and there's nothing wrong with that. There's no benefit to them. Removing them will actually help reduce your cancer chances. Tying them is useless. Like, if you're done, get rid of the tube. The only reason you would tie them instead of remove them is in case you're not 100% done, in which case put in an IUD. There's no reason to tie your tubes.
Recurring miscarriage at 6.5 weeks, what should I be testing for? Should we be considering IVF?
IVF is an option with PGT, so you make sure your embryos are normal. You should be doing fertility, microbiome, immune protocol. You should be looking at your partner's sperm for DNA fragmentation, oxidative stress, hyaluronic acid binding, survival. You got to look at your BMI. You got to look at your diet, your cholesterol, your vitamin levels. Look at the shape of your uterus. Check a thrombophilia screen. All of those things can be important.
My specialist said based on my age, I should start fertility treatments. When is the best time to go do blood work for progesterone, LH, etc.?
I love these like egregiously overbearing statements, right? Like, based on my age, I should do fertility treatments. That's nonsense, right? Like, your age is not an indication for fertility treatment. I get it all the time. They told me that because of my age, I should start IVF. Well, that's BS. It's simply not true. You do not need to do fertility treatment because of your age. you may be better off doing fertility treatment, but it's not a necessity, and it's certainly never an indication for fertility treatment. You might be 45, you got good ovarian reserve, the sperm's great, you want to try on your own. Honestly, I'd probably encourage it because your chances with IVF are low. So why would I take 10, 12, whatever $1,000 from you, force you into an IVF cycle, which is probably not going to work, when you could just go home and have fun having sex? Like, the age thing is stupid to use as a criterion. So I would never support that. Now, if you come to my office and you say, I'm 39 and I want 3 kids, we're going to talk to you about the benefits of fertility preservation, because it's going to be very difficult for you to have 3 kids. But it's insane to tell people, you're this age, so you need fertility treatment. I hear it all the time, in particular in the US. US patients constantly are being told, oh, you're 39, you need IVF. Well, that's total BS. You don't need IVF. You have lots of options, you need options, and then you need to make a decision that's right for you. One option of which is IVF, but there's nothing that says that that's the only choice for you.
I got a big one here. You ready?
Ready.
First retrieval, 6/8, fertilized by ICSI, got 5 embryos.
Okay.
Now, for the second retrieval, a new clinic wants to try conventional fertilization as no obvious sperm issues. However, morphology is 4% and TZI. Value is 2.3, and literature suggests that ICSI with values above 1.9 DNA frag is 3%. Should I insist on doing ICSI again, or at least half and try conventional?
Well, you're asking someone super biased. We don't do conventional IVF. We only do ICSI because our fertilization rates tend to be quite high. So I would always do ICSI every time, guaranteed. Yeah. We had a lady come to us who had previously done terribly in the US. We used our protocol. We got more eggs from her than she typically gets. I managed to retrieve all of the eggs that were there, which was fabulous. And then we fertilized 80% of them. But we did that with ICSI. Had I done that conventionally, I guarantee you we would have ended up with half that. So if even that. So ICSI makes sense in a lot of cases. And if you've got a good lab, that's the one you should be doing. Can I ask this oral progesterone question?
Of course.
This is from Valia VK. What a cool name. I love that. Valia. Which progesterone is better, vaginal or oral, or I've heard injections? So oral progesterone has a 10% bioabsorption. So it's useless. So nobody should be taking oral progesterone. You're either doing vaginal or injectable or both, and it should always be both, because both has been proven to be better than doing just the vaginal or just the injectable. So it should be PIO, progesterone and oil, plus your vaginal route.
What supplements do you recommend for PCOS?
NAC, resveratrol, coenzyme Q10, inositol, and ALA.
Oh, I got a big one for you.
Uh-oh.
Ready? I'll take that as a yes.
Yeah.
Hey, Dr. V, I've had 4 transfers, 4 retrievals, only getting around 10 eggs each round, and 2 making it to day 5.
Wow.
3 of them, PGT embryos, out of those 1 MC, 1 chemical, and 1 didn't stick at all. 1 embryo not tested failed as well. I found out I had a blood clotting issue after MC. I do know that I have mild endo, left tube removed due to having fluid. If I were your patient, what would you recommend? I am getting pregnant, but something is keeping me from continuing and staying pregnant.
Well, you almost for sure have a microbiome disorder, and I'd probably check your immune system. I would check the shape of your uterus. We would use our endo protocol because you have mild endo. That includes all sorts of parts to it, high dose progesterone. There's a lot of things. We put you on ALA, we put you on supplements. There's a lot of stuff we would do for you to improve the chances. We do have a very patient-specific approach to things, which I believe changes the whole dynamics of how people do. Because when you just treat everybody the same way and it's like cookie cutter medicine, you treat every endo patient like they don't have endo, you get really crappy results. But when you treat people like there's individuals and you have to account for that individual's biology, you do better. So that's what we do, and it works. Like literally, those messages I've been posting lately, I get those every day. Someone says, "Oh, we used your protocol. We got pregnant after years of failure. We used your protocol. We got more embryos. We used your protocol. We're finally pregnant." So yeah, I mean, it works. We believe in what we are doing because the proof is in the pudding. It's there.
I'm not sure I like this nickname that they gave us, but I'll let you be the judge of it.
Oh, okay.
All right. Third shows the charm. Dear Zoolander and Hansel, does your lab use calcium lonophore on all patients? What are your thoughts of using it if over 40 and excellent fertilization to use for euploidy?
So calcium ionophore, actually, there's a very recent meta-analysis which shows a benefit. So we've been using it for several years now. We only do it when you had poor fertilization or you had poor blastocyst development. We don't do it on all cases. Yeah, you don't need it for all cases, but we do it on most of the cases that have low egg yield, previous failures, poor blastulation, poor fertilization. Yeah.
Would fasting correct the microbiome? And how many max hours can you safely fast with PCOS?
Intermittent fasting has been shown to be beneficial for PCOS patients. So, depending on who you believe, it's anywhere from 12 to 16 hours typically. I have a very good friend that's a fertility lawyer who I love, Michelle Flowerday, and she fasts. She has the craziest schedule ever. I am tempted to do it because I have now joined the ranks of having too much flubber on me. But she does no food other than between 12 and 6 for 5 days. And then on one day, she eats absolutely nothing for 24 hours. And the next day, she just eats normally. And she says she's in the best shape of her life. Her husband's in the best shape of his life. And I have to admit, like, I don't think there's an ounce of fat on that woman. Like, she looks great. So, and she's full of energy. She's go, go, go all the time. She's a phenomenal lawyer. I might just try it to see how it makes me feel. So I did try two
She has
days
a
in a
full
row.
24 hours?
She fasts for 24 hours. So I actually did it for 2 days in a row. I didn't eat anything until dinner time, 2 days in a row. And I
Yeah,
actually didn't feel that bad.
yeah,
So I
that's
don't know.
easy. That part's easy. I can go tons of hours with no food, knowing that food's around the corner. But the 24-hour fast, that's hardcore.
I did it. Like I had dinner and then I didn't eat anything till the next night's dinner. That's a 24-hour fast.
Oh, that's a 24-hour fast. Oh,
Yeah.
I see.
You guys do
Oh, I
that
see.
when you guys do that when you don't wake up during Ramadan
Yeah,
or
yeah, yeah, right.
yeah,
Yeah, yeah, yeah, yeah, yeah,
which
yeah,
is
yeah. Oh, I
cheating.
see. So it's not like a
That
whole day
is
of no
totally
eating.
cheating. Yeah.
Oh, I see.
Yeah.
24 hours, not a whole day of no
Yeah.
eating. I
My
get it.
son
I
has
get
some
it.
friends and they sleep through the morning part. They don't wake up and then they just, sleep away half the day and then they eat at dinner time and they think that they're fasting. That's not,
Oh yeah, that is the ultimate cheat code. You know what I
that's
mean?
the
It's the
ultimate.
ultimate cheat
Yeah.
code.
That's fake fasting.
Hey, they stay up all night, they sleep all day, they wake up right in time for dinner.
Yeah, that's not fasting. Yeah.
Got
There,
8 normal embryos. Go ahead.
oh no, I was just going to ask this question from Valia again. Would fasting correct the microbiome? So that part I didn't answer. So here's the cool thing. I don't know anything about fasting in relation to microbiome. I'd have to look it up. However, a family doc that I'm working with recently started using Ozempic, and she swears that her microbiome improved by virtue of using Ozempic. And I've never seen anything about that, but it is a cool idea and something we might take a look at. So I might explore that.
Got 8 normal embryos at first round with stage 4 endo,
Wow.
but have recurrent pregnancy loss. Did surgery, but doctor isn't suggesting suppression, but said we can suppress for a month. What are your thoughts? My doctors here won't listen how I can work with Dr. V from the US. I'm unable to travel, but how does the process work if he creates the protocol and another doctor follows it?
Well, if your doctor isn't listening to you, I'm not sure they'll listen to me, but we do that. They just have to talk to me and I'll convince them and we give them our protocol and then we go from there. We do that all the time, but you have to have a willing doctor. Otherwise, we just tell patients to ship their embryos to us and we do it here and it's not expensive to ship embryos. It's very safe and we're so much cheaper than the US. Usually it actually costs you less to move your embryos here and do an embryo transfer with us than it costs to actually keep your embryos where you are and do them there. So depending on who your doctor is, we usually they'll either listen or you just move your embryos to us and we do it for you.
How many days prior to an embryo transfer do you recommend doing PRP for thin lining?
A month. Yeah, it works better if you give it a lot of time. So that's what we do.
How does the wait list work if you want to transfer for your second child? How long does the process take?
How does the wait list work? There's no wait list. I'm not sure what they're asking there. We don't.
They want to see you, Rahi. They want to know how long it takes to see you.
We go.
I've been using supplements you recommend for endo. I have a condition called lichen planus, and I feel the ALA and curcumin is helping my skin a lot.
I missed the first part you cut out there. Sorry. Say that again.
Oh, sorry. Um, I've been using the supplements you recommended for endo. I
Yeah.
also have a condition called lichen planus, and I feel the ALA and curcumin is helping my skin a lot.
Oh, great. That's awesome. Follow-up question to the one from Razia Mirza. Should I go for a
Yeah.
month of suppression only? No, a month of suppression is useless. Lupron alone does not work for patients with endo. That's completely useless. You need a full endo protocol. 1 month of suppression is a joke, and there's good evidence that that's useless. So don't do that. That's just unnecessary torture.
When is it necessary to use steroids with Hashimoto patients?
Yeah, so I found a meta-analysis that showed that it was beneficial. And no matter how much I looked after that, I could not find it again. So it is a reduction in the inflammation. And so probably as a result of that, you actually do better and you get a higher success rate. I gotta, maybe I'll task Isabella with finding that. You know what? I'll write that down and tell Izzy to find that for me. That's a good one.
What do you consider a full fertility workup?
Okay, male, vitamins, basic blood work, CBC, cholesterol, insulin, um, sugar, blood type, and then we do infectious disease screen. And then ideally in my perfect world, I'd get a sperm test, a overnight survival test, and a sperm DNA frag. That would be my entry level in an ideal world. Normally, the last two parts of that, this overnight survival and the DNA frag, we don't always get because it's got a cost associated with it. On the female end of things, a month of monitoring with, 3 or 4, maybe 5 labs and ultrasounds. Saline infusion, sauna histogram, all the same labs as the men, vitamins, hormones, looking at your infectious disease screen, your cholesterol, your sugar, your insulin levels, your basic blood work, ferret, and things like that. And then your progesterone level on day 23. To me, that's a pretty comprehensive initial evaluation.
Hi, doctors. That's us. Naturopath says resveratrol should not be taken at time of transfer due to lining and risk of miscarriage. PubMed study. Curious on your thoughts on your endo protocol.
Yeah, we're just not seeing that, so I don't believe it. Our patients are getting pregnant left, right, and center on resveratrol, so I don't believe that that's a problem. And it's a
Do you
super
recommend waiting a certain time?
oxidant. Sorry, T. It's a super powerful antioxidant, so it actually doesn't make sense that it would cause any harm. Go ahead.
Do you recommend waiting a certain time period between COVID infection and egg retrieval? Can it impact egg embryo quality?
2 months. And my opinion, yes. Especially the newer strains of COVID. I don't know about you, but like I just spoke with one of our employees. She had it last week. She felt like she was dying again. I think the newer strain of COVID is like getting more aggressive because it was like obviously horrible when we had the pandemic initially. And then it started getting a little more mild. And then I thought it was kind of dead. And now it seems to be sort of ugly again. So, um, God help us all. I hope there's not another bad version of it coming, but it is aggressive.
I've had two failed transfers using ERA late receptive transfer timing. If this test was incorrect, what's the typical transfer timing after start of progesterone for a day 3 embryo? Thank you.
Yeah. So the ERA test has been proven to
I thought
reduce
you'd
your
like
chance
this.
of success by 13%. So abandon the ERA test. A day 3 embryo goes in after you finish 3 days of progesterone, plain and simple. There's absolutely not a shred of evidence in existence anywhere to suggest that anything differently should be done for that. So you should definitely stick with that. Hey, our TikTok says the number of viewers hit an all-time high in 30 days. Brilliant. Hey, that's not bad. Cool. You still there? Uh-oh. I may have lost T. T? Well,
There we
I
go.
guess. Oh, there you are. You disappeared for a
Dr.
minute.
V, would you recommend two embryos at once or one embryo has low grade?
We
Yeah, can you
generally.
hear me?
What's that?
I'm here. I'm here. Do you hear me?
Yeah, now I can. So we generally always recommend one embryo at a time. There are some exceptions to that, but
Okay.
generally
What, Dr. V, would you recommend two embryos at once?
yeah, one at a time. What? I think you're
What are the
sick.
benefits of taking baby aspirin while preggo?
Oh, improve blood flow, reduce preterm labor, reduce preeclampsia, less complications in the pregnancy, probably a lower chance of developing blood clots. Yeah, lots of benefits. We have a whole video on that.
How long does it typically take for your office to email back regarding setting up a consult?
A week or two. It depends on how busy we are, but they got to fit everybody in. If you're not getting a reasonable response, message me and I'll figure things out for you.
Why would you be put on birth control prior to starting egg retrieval for IVF?
Because your doctor doesn't know what they're doing.
Boom.
Birth control before IVF is terrible for you. Now, some people do it in order to time when you're going to roughly have your egg retrieval so they don't have to work weekends and blah, blah, blah. But that's terrible for your eggs. So, no one should be on birth control prior to IVF, in my opinion. Last question.
PCO, PCOS and unicornate uterus, two unsuccessful IUIs.
Yeah.
Yeah, two successful IUIs. Looking at starting IVF in the new year. Any tips to prepare?
Take your vitamins, take your supplements, make sure your weight's optimized, make sure you
Did you
don't
catch
have
that?
What was that? Oh, I lost you, T. So,
Why do SCH happen more often than IVF?
why does SCH happen more often with IVF? IVF pregnancies are complicated.
Hmm.
So there's probably some vasculitis there. There's lots of inflammation. That inflammation leads to vasculitis. So there's more bleeds. 9 o'clock, buddy. You got to get to your conference
All
and I
right.
got to go home. Okay, so next week I'm going to be away because my wife is taking me to listen to the opera in another country in another continent. Very, very cool. But I have some time at least to study. And then the week after that will be the 23rd. Are we going to do one on the 23rd?
I don't know. Is that like a holiday or is that not a holiday?
It's not a holiday. It's the night
I'm
before.
available. I'm available. I think I go to Chicago. Hold on. I'll tell you when I go to Chicago. Hold on.
Chicago. What are you going
I
to
think I go
Chicago?
to Chicago like Christmas or the next day. So I'm actually free on the 23rd, pretty sure.
All right. Well, then let's do the next show on the 23rd. What are you doing in Chicago?
You know, deep dish pizza.
Oh, you're just going, you're taking the family
Yeah,
to
I'm taking the family for a little Chicago trip. Yeah, yeah, yeah.
nice. All right, I'll tell you all the sweet spots. Have a great night,
All right.
everybody. Lots of love. Thank you for watching. Check out our Instagram and our YouTube, please, please, please. And we will see you next week on Fertility Fact or Fiction. Or the week after next on Fertility.